Okay, this is chapter 2, inflammation and healing. Um, Looking back at anatomy and physiology, we talked about our normal lines of defense. So we talked about the first line being the skin and mucous membranes. Then the second line were your phagocytotic cells, natural killer cells, white blood cells. We had inflammation, we had complement, we had interferon, and we had fever. All those were the second line of defense. And you want to remember the first and second line of defense are non-specific. The third line, your adaptive immune system, is something that is more specific, and it has two arms. And the first arm is the B lymphocytes. That is your humoral immunity, and B lymphocytes produce antibodies. And then you have the cell-mediated part, which is your T lymphocytes that are involved in taking care of cells that have infections from the inside or are cancerous, but they take care of cells that have issues that are very specific. So that's just an overview. If you look at the next picture, you'll see that this kind of gives you an idea of what's going on with the different lines. So non-specific first and second line through here. So in that first line of defense, skin and mucous membranes, you have tears, fluids, saliva, mucus, gastric acid, and then here's the skin and mucous membrane barriers. Then you're into the second line of defense, so you have your phagocytosis going on, your macrophages, your white blood cells, inflammation, interferon, complement, fever, all those things that are also nonspecific. And then if you bypass those, now you're in that third line of defense, which is very specific. You have B lymphocytes producing antibodies and T lymphocytes involved with cell-mediated response. Now, if all of these are overcome, then we have a problem, because now the body can be invaded. So inflammation, let's talk a little bit about inflammation. That's the body's response to injury. It's the body's way of sending out an SOS to draw in all the arms of the immune system to fight off this infection. So the localized effects of inflammation are redness, heat, swelling, and pain. Sometimes, if that inflammation is in a joint, it can also result in loss of function. Systemic effects, if a person is overcome with an inflammatory response, they may not feel good. They may experience malaise, headache, anorexia. And then remember that inflammation is caused by pyrogens, and pyrogens are caused by certain types of body cells, some immune cells, that will send out these chemical messengers. They are received by the thermostat of the body, which is the hypothalamus, and the hypothalamus produces something called prostaglandin E that resets the temperatures to a higher level, and this results in fever. And this walks you through the course of a fever, releasing the pyrogens, resetting the thermostat to a higher level, temperature goes up, you feel warm. Here's the things that happen by this increase in temperature. Shivering, you get chills, vasoconstriction, the skin, so you get kind of pale. Your basal metabolic rate goes up, increased heart rate, and you kind of curl up. You just don't feel good, and you're cold. And then by all of this, then you start to reach a new warmer temperature, and you can take treatment to remove the pyrogens. You can take aspirin or something else, anti-febrile medications, and or go through the actual infection without treatment. This is that new normal. Then eventually the body's responses to that increase results in heat loss, vasodilation, sweating. You feel awful, lethargy, and now you extend the body, so the chills, the heat loss, the sweating, and eventually as the infection is eradicated from the body returns to a normal temperature. So that's the course of a fever, and I'm sure everybody's experienced that at some point in their lives, the cycling that occurs, and not feeling very good at all. Changes in the blood with inflammation, usually, depending upon the problem, you'll have an increase in white blood cell number, so that is called leukocytosis. And depending upon what type of infection you have, you will see an increase in a certain population of white blood cells. Remember that we had 5 populations. And neutrophil increase would mean that you have a bacterial infection. Lymphocyte increase would mean that you have a viral infection. Eosinophils reflect a parasitic infection or possibly an allergic reaction. And basophils, because they produce histamine, they can be one of those things that can occur as a sidebar to any type of infection to cause vasodilation, increase mucus production in mucous membranes. And the 5th group is the monocytes, and they're kind of the cleanup men. They go around and clean up debris after the infection's over. Now, the differential count is part of what's called a CBC test by the lab, and that's a complete blood count. And so this is all part of that really quick test to give you an idea of what the infection is so you know how to treat it. Plasma proteins that are increased: fibrinogen, prothrombin, clotting proteins in case there's a break in blood vessels involved with this injury or infection, whatever's going on. The liver produces something called C-reactive protein, and it's kind of a generic marker that lets you know that there is an inflammatory process going on. And CRP is good because it can bind to microbes, it can fix complement, and you know complement can cause cytolysis. It can draw in your phagocytes. It can help remove antibody antigen complexes through immune clearance by attaching to red blood cells. So all those things we talked about in A&P. And then there's another test in the lab that they can do that's called the erythrocyte sedimentation rate. Now, it takes red blood cells a certain time to settle in plasma. But if you have an increased production of plasma proteins due to an inflammatory process going on, that's going to thicken up the plasma and make the red blood cells take a little bit longer to settle to the bottom. And they have an acceptable time and then elevated times that have been determined to indicate that there is an inflammatory process occurring. It's an old tried and true test, been around a long time, but they still use it and it's very effective. There's cell enzymes released from necrotic cells, and these are where the SOS signal comes from initially. These are the ones that go out and actually draw in the immune cells to take care of the problem. So if you look at this picture here, now you're going to see a little flow chart of what's going on. Here's your tissue injury, and tissue injury is going to cause the inflammation because of all the release of these chemical mediators, histamine, kinins, prostaglandins, and this is what these chemicals can do as a whole. Vasodilation, opening up blood vessels and increasing blood flow to the area so that you can get some of those plasma proteins out there. Because blood's a little warmer than body temperature, the area becomes hot. It becomes red from the increased fluid. Increased capillary permeability causes edema. Swelling will press on nearby nerve endings and result in pain. And also these chemical messengers will cause white blood cells to move to the area, and that term is chemotaxis. Now, because you are releasing these proteins, clotting proteins, into the nearby tissues, that's going to clot and form a fibrin mesh, walls off the area. These white blood cells, they phagocytize the bacteria and infectious agents in the area. It can remove cellular debris, and this sets up the stage for healing. Now, if this process does not take care of the infectious agent and clean up the area, then you might have a chronic inflammation, and so we're going to cycle back around because you're going to have more inflammation, more of this going on, and it's not going to heal, and you might wind up with scar tissue resulting because it persists for a long period of time. Under normal circumstances, if it's not a really serious injury, then healing occurs by resolution, which the damaged cells recover. That's minimal damage. Or regeneration, replacement of the same type of cell. Might take a little bit longer, but the cells are able to replace themselves over time. And if you have a very serious injury, then it may result in some scarring. So I'm going to go to looking at treatment for inflammation. Um, Aspirin, acetylsalicylic acid, is a very simple, cheap treatment for reducing prostaglandin synthesis at the site of inflammation and reduces the pain, so that's an analgesic, and reduces fever, antipyretic, and it's an anti-inflammatory, so very, very well, um, very long, has been used for a long, long time. Um, but it's one of those things that you want to be careful of using to treat children with any type of infections because of the incidence of Reye syndrome, R-E-Y-E apostrophe S. And Reye syndrome occurs in some children where neural tissues will swell, and 30% of all children that have this condition will die because of it. So it's better off to use non-aspirin containing preparations for children. So we're talking about things like Tylenol that have acetaminophen. And acetaminophen is not anti-inflammatory, but it does relieve fever and pain. So this is more advisable when you're talking about children. Then you have your non-steroidal anti-inflammatory drugs, ibuprofen, Advil, and Motrin, and there's many other varieties of this. Then you have glucocorticoids, anti-inflammatories, which are pretty powerful. Hydrocortisone and prednisone are the main players there. Now, healing, we mentioned resolution was where you have minimal tissue damage. Regeneration is where you replace the damaged tissue with the same tissue. And then if you have a very serious injury where it doesn't heal properly, then you have scar tissue, which is fibrous connective tissue. Now, there's two different types of intention. So healing by first intention is a clean wound with little scar tissue. Healing by second intention, the wound is a lot larger, there's more inflammation, it takes a longer time, and a larger scar forms. It's based on what we talked about earlier when we showed that flow chart, how something that's chronic doesn't heal right away can result in this second intention. And here's a look at it in picture form. So it's giving you an idea of healing by first intention. You can see the normal process, and here they've even thrown a stitch in here to pull the edges together, and you get the formation of granulation tissue. You do see a scar underneath, but the epithelium at the top doesn't show any injury, so that's first intention. Second intention, the wound stays open, it doesn't close, and you wind up with scar tissue forming across the top, and it's a much wider area of fibrosis there. So that's second intention. Complications of scar tissue formation. There's a few things that can happen. Number one is loss of function, because scar tissue doesn't function like normal tissue. It's not really elastic, it's not really stretchy, and remember, if you think about what happens in a myocardial infarction, when you lose cardiac muscle tissue and scar tissue replaces it, it doesn't contract. It doesn't work like cardiac muscle tissue, and so the muscle gets weaker and weaker. Number two is contractures and obstructions. The scar tissue tends to shrink and can interfere with the function of a joint and can result in deformity, like esophageal scarring and obstruction. Third thing is adhesions, bands of scar tissue joining two surfaces that are normally separated, like adhesions between loops of intestines. And you can see pictures of these in your book. Hypertrophic scar tissue is what you're looking at here. This is an overgrowth of fibrous tissue, excessive collagen deposits that may develop, leading to hard ridges of scar tissue, or what could result in a keloid formation. And this is showing you over on the left, you see a normal scar, and it can be pretty disfiguring if it's on the face. And this is the keloid. So you see excessive amounts of deposit here of scar tissue. Now we'll look at burns. And burns are classified two ways. They can be classified by the depth of damage or the percentage of body surface area involved. So first of all, we'll look at classification of burn injury by depth. So the first thing is a partial thickness burn or superficial first degree burn. and that's where you have damage to the epidermis. And usually it's red and painful, but tends to heal pretty quickly, like a mild sunburn. Number two is a deep partial thickness burn. And this is also called a second-degree burn, so it involves destruction of the epidermis and part of the dermis. So this one goes down into the upper part of the dermis. It's red, you can have swelling, and you do have blisters. This is usually what separates it from first-degree burns, and it's often hypersensitive and painful during the inflammatory stage. Full thickness burns, third degree, destruction of all skin layers and often underlying tissues as well. So that's a full thickness is third degree burn. Emergency care, you've probably heard of stop, drop, and roll. Cool the burned area with cold water, cool water. Remove clothing if possible. Cover with a clean cloth, sometimes the inside of a sheet or sterile gauze, and then consult a physician. Okay, front of the head is 4.5%, back of the head 4.5%, so total head 9%. Upper part of the anterior portion of the trunk 9%, abdominal region 9%, that's 18, the back is 18, for a total of 36%. Both arms, front 4.5%, back 4.5%, both arms 18%. And perineum, the genital area 1%. Legs, both legs 36% for a total of 100%. So that's the rule of nines and how you would figure out what percentage of the body is burned by using these calculations. Now, effects from burn injury: shock from loss of fluids from the circulatory system, respiratory problems, inhalation of toxic and irritating fumes. Pain, burns are really painful, so something like an analgesic or painkillers are required in many cases. And infection, the most common cause of death in serious burns is infection, because if you burn off a significant part of that first line of defense, which is your skin and mucous membranes, then you open yourself up to infection, which may overrun the body and cripple the immune system's ability to fight it off. And the first cause of death usually is from circulatory failure, circulatory shock, which we had up here. And that's because you have a lot of capillaries in the skin, and if you burn off a significant amount of capillaries, you could lose significant fluids. So this picture here is looking at skin grafting, showing you a mesh skin graft on the left, and then I'm being measured for an elastic garment to control scar tissue from a burn. So, depending on the severity, burns could take a few days to a few months, and scarring and contractures could further complicate the process. So, it can be something that could affect a person for an entire lifetime, depending on the severity.